welcome from Darling Harbour from the Rhinoplasty Symposium in 2022. I have with me here Dr. Goksel from Istanbul and Dr. Yves Saban from Nice, two of our esteemed faculty. And I'd just like to ask them a couple of questions and welcome both of you to Australia.
Thank you. Thank you very much.
Thank you very much for coming. Dr. Goksel, I would like to ask you, tell me about the life of a rhinoplasty surgeon and continuous improvement.
Rhinoplasty is an interesting surgical procedure. You can never say that you're done. So it is the main and important issue in rhinoplasty that rhinoplasty surgeons has to continuously educating themselves. Then I can say that whenever I say I'm done, it means that I'm not. So that's why this kind of symposiums are very, very important, and it's very well organized. Thank you, Peter, for the invitation and organization.
Thank you.
And we have time to discuss a lot. We have time to talk and explain what we learned and what we are learning and what we are doing. So summarizing the subject, that rhinoplasty is a field that you cannot stop learning, you cannot stop educating yourself, and sharing our knowledge is the most important thing in rhinoplasty.
Thanks very much. And that leads us on to one of the biggest changes in rhinoplasty in the last few years, which is the concept of what's called preservation rhinoplasty, or dorsal preservation rhinoplasty, which you've been doing for years, Dr. Saban. Why did that take so long to become something that everybody wanted to do?
Dr. Callan, thank you very much for the invitation. It's great being here in Australia for speaking about new trends, let's say, in rhinoplasty. And Dr. Callan and Dr. Marcel could gather a wonderful faculty coming from all over the world, and we are really enjoying being here. And the meeting is outstanding. We are learning a lot of things. So, coming back to the question now, I would like to say that we can consider that in rhinoplasty there are different philosophies, different concepts. The most usual one is when the patient is visiting a doctor for changing the nose. Generally it's for reducing the big nose or hump, and what we are doing in our mind is, okay, I have to remove part of my hump to make the nose smaller. This is the usual way. The concept of preservation is different. The philosophy is, what can I conserve, can I preserve in the nose of my patient? When I see a patient with a nice nose but a little bit too big, the question becomes, what can I preserve? And then you have to find a solution to keep the natural and normal shape, morphology, anatomy of the patient, to make it smaller and even nicer. And so the concept is just to preserve the superficial structure and to work on the foundations of the nose in order to change the shape. And and the main change is this one. It's not a new trend. It was described in the late 19th century, but now it becomes again popular thanks to the evolution of the techniques. And what said Dr. Goksel just before is true, and thanks to your question. We are never ending with learning, and it's usual to say in our specialty that the rhinoplasty doctor never graduates. It means that we are always required to improve ourselves.
Thanks very much. Well, Dr. Goksel and Dr. Saban, thanks for talking to us, and thanks very much for coming to Australia.
Thank you very much. It's our pleasure.
Thank you so much.
Thank you.